there's been a lot of improvements generally on the health sector. But generally, as in regards to the equipment, even you told me that you travel to, you go to different hospitals. Yes, I said Lagos. You go to different hospitals,
no, I
you
thought
see
you said
different
Nigeria.
equipment. No, you didn't. You heard me right.
I actually heard you
I said
right.
yes. So you've seen a bit of improvement. So it's people living here might be totally oblivious of what's really going on outside Nigeria, outside Lagos.
True.
People are frustrated about our health system,
me
and
tell
every
you.
single day, people are dying.
There was a story that they brought to my notice last week, and it was, the picture I saw was a BRT accident, actually. This lady said she was leaving work very tired on last Friday, and that she just got here, there was an accident, a bike man on the floor, and they were saying, hit his chest, pour water. And she's like, why haven't you considered a hospital? Nobody there thought to take the guy to a hospital. She said, oh yeah, put him in my car. She said, as she was going, the only hospital she thought of was the hospital of our place of work, which was 40 minutes away. Someone in the car said, there's a general hospital 8 minutes away. So they drove there. She said, one nurse ran out, looked in the car at the patient and said, no, take him away. That she got down furious. That, you want him to die? Where will I take him to? Eventually, one doctor came out, looked at him and said, oh yeah, let them find who can carry him. They didn't have a stretcher. General hospital. Luckily, other bikers had followed her. So his colleagues carried him into the hospital. The doctor stabilized the bike man, and she was given a bill. She said that she was driving out late in the night. They said, no, she can't go out. That she, who brought in emergency, must bring a notice from the doctor that the guy is alive. A general hospital. So anyway, in her story, what she wanted to buttress was that guy could easily have died.
Easily.
And we have many situations like that. We have a colleague in TVC who they were just trying to transport him from one general hospital to the next. They didn't have oxygen.
Right.
There is...
After a successful surgery.
2 successful surgeries.
Very successful. And everybody was happy. In fact, we've spoken to the guy. He smiled. We had a couple there. There's one of my colleagues here, actually, one of our producers, went to see him. And they spoke. So the guy was there and he could feel his legs. They lift your leg. He could actually have sensations. But now, they always say that after 24 hours or 48 hours, post-operation is very, very critical. You have to keep it on intensive care to always monitor him. Unfortunately, when he started having the complications, there was no oxygen to keep him alive.
You know, there is this lady on my Instagram, and you know, anytime I post a picture, she posts that please assist. So I went to her page to check the child. If you see his eye, in fact, he has destroyed half of his face, half of the boy's face.
So what happens?
It's cancer. A little boy is like 6. If you see, it's so sad. If I was a rich person, I would pay for that boy to go for treatment. You know, I look at it, and it's something I cannot even look at. So I just look, I mean, I'll just contribute my own widow's mite, you know. But come on, our leaders go abroad for, even if they have coughs, like...
Whiplash. You know what whiplash is? That's your seat belt just gives you a scratch. That's whiplash. Our leaders travel abroad for whiplash.
See the one that built a multinational clinical hospital.
That's the one I'm talking about.
Then he did not even stay there for treatment. He traveled abroad. Eh? Now, even our Pata's son.
We'll come to him.
Let me come to him.
I hate to do the same wailing of our leaders.
Because we're just
this
wailing.
Is completely a failure of system. We have growth without planning. Our leaders see the population grow part-time and still have the same old general hospitals built in the 70s and the 80s to take care of this generation. Look at the new mother and child care centers. I stayed in one that, you know, the new government in Lagos State built. It was started by Asiwaju to Fashola now. Presently, as I'm talking to you, is overwhelmed. Because you know what happens? My area I'm of is largely populated by a particular tribe. What they do, you call your sister, I beg hospital way good day here. They will rush the person. And the bus park is at Maza. Once they are dropping, they will come. I don't have relative. They come straight from there with emergency cases. And the hospitals now are overwhelmed. We are growing in population and we are not planning. And it's very sad. Because if you see oxygen they are built in the hospital per ward, I think we have just 2 oxygen or, yes, 2 of them. One close to my bed and the other stand. Okay, 2 or 4, let me not be exaggerating. And now, when you have emergency cases, one has failed, the other one has failed, only one is working. If you have 2 cases, what will happen? We are growing by population. And a foresighted leadership is one that provides for that growth.
So that's
where, takes advantage of that growth.
Going back to leadership now, because the issue of the fact that our budget for healthcare, it's almost as if, you see, I think we had a guest here that was telling us that let's focus on one thing, either education, health sector. There's got to be something that Nigeria, or electricity. Solution. Focus on something such that we know that, okay, we're going to make Nigeria the destination for health tourism. Everybody travels to India.
Mariah,
every little thing right now, I'm looking for money for India.
Solution. There's an African proverb of that, if you do not eat at home, you'll never leave money for food in the house. We can never improve in our healthcare system as far as any leader has the option of traveling abroad. For the rest of us Nigerian population to have basic, and I mean basic, the president's wife was complaining about paracetamol and gloves, syringe in Aso Rock Hospital. For us to have basic healthcare, it must mean that our leaders must, by compulsion, use our healthcare facilities. Let me explain.
We had debates in the house.
Let me explain. Let me explain why I'm saying that.
You see, instead of debating about whether they are going to do death sentence
hate speech or not,
hate speech, they should debate on the healthcare system in Nigeria.
Okay, let me explain why I'm saying that.
And not just primary healthcare.
Yeah. I am an ESCO in my estate. It's free of charge that you do ESCO work. The president, the vice president, senate leaders, they are paid. It's not free of charge work that they're doing. If my ESCO president goes into our coffers and says, and she has not equipped the general hospital in our estate, she has not funded the public primary school in our estate, puts her hand into our coffers to go to a hospital abroad, immediately we will fire her. I'm using that example to say that, yeah, exactly. So anybody who is a public servant, your first assignment as a public servant is the people. As far as the rest of us do not have adequate health care, the president's son, Yusuf Buhari, came from Germany. Yeah. The Minister of State for Health went to go and welcome him at the airport. They never told us that he went for medical care in Germany. But they are welcoming him.
May I inform? He was seen to see that stress.
Let me take this call. Hang in there. Let's take this call.
Let me just tell you a story this morning that happened to me. It was during the Governor Fashola's regime. There was an accident along. There was an accident that occurred in front of Coca-Cola just for HTV gate.
Right.
The vehicle knocked the man down, and he was gasping for breath. A policeman just told me that I should help that accident victim. I laid that man inside my car. I took him to General Hospital. Immediately we got to General Hospital, the policeman just told me he wanted to buy card outside, and that was how he left me. And I was crying for help for doctors and nurses in that hospital to get that man for me. In fact, they left the man inside my vehicle for almost 2 hours.
Can you imagine?
It was just about a few minutes for that man to pass out.
Jesus.
That I had a feeling that the governor Fashola then was about to visit that general hospital. When I heard that feeling, I was crying, I was shouting at the top of my voice, Governor, come and help me, oh. That was how the doctors and the nurses came out to help me, and they took that man out of my car. Assuming that man died in my car, probably I'll be in jail by today.
Thank you very much for sharing your story, Alayinka. Going back to the president's son, because they told us...
Samaritan.
Yes.
No, Morale, quickly, let me just establish. We heard, according to the report, that he was treated in Cedar Crest in Abuja and went to recuperate in Germany. That's a different story.
Don't let me
May I just inform us that this is not for lack of well-trained personnel. Right. We have the best hands in medical field in Nigeria, to the extent Namibia is dragging our doctors. That's the way Liberia wants 6,000 teachers. They are taking our doctors away with bogus motivation as pay.
What are you saying? You mean Yusuf Buhari just went to recuperate and a minister, wait. So they told us the surgery was done in Nigeria, and our minister, whose patients are dying every day in General Hospital, went to welcome him at the airport. He came in a private jet.
You are joining issues. You are joining issues. Let's go on a break.
Should the minister, let me ask you this question, should the minister even go
to visit? That's a different conversation.
Let's
go on a quick, because when we come back, we'll bring our guests. That's a different conversation. We'll be right back.
Like this.
Stay tuned. Your View will be right back. Welcome back to Your View.
Thanks for staying with us. So we have joining us with is the founder and executive director, Innovation Matters Steering Committee member, Lagos State Civil Society Partnership, Dede Kadri. Welcome to the show, madam.
Thank you. You're welcome.
So you've heard our lamentations.
Yes. Please hear my own first.
Hang in there. Okay, what's your lamentation?
I want my lamentation because my prayer is that I should never be sick because I will die here because I don't have money.
Reject it for you in Jesus' name. You don't die.
I have not finished. And I just the unfairness of it. If it was President's son that was in Dapchi, do you know they would have found all those children by now?
The next day.
The next day.
Okay, all right.
Absolutely.
So we have lamented.
Why
Like hanging them.
Okay, so Africans.
Wait, we have lamented. We'd like somebody who is a professional to tell us the real situation out there. Are we just seeing it from a myopic point of view? What's the real situation in our health sector out there?
Yes.
Well, it's pretty bad, I must say. You know, while listening to all of you speaking, I laughed a lot because, you know, when you look at the data, it's a reflection of what's going on in Nigeria. So life expectancy is 53 years.
We want supposed to be 47.
There's no surprise when you see younger people dying. You know, than older people. So I have an aunt who told me, you know, I was telling her, take care of yourself. And she says, no, my dear, we are not the ones dying. It's the young people dying. So that's, and she's almost 90.
Wow.
So it's an indication of what's going on in Nigeria. Now, when you look at our, you know, life expectancy, you can only compare it to countries like Somalia. Somalia's life expectancy is 55.
And now is 53.
Yes. Ethiopia's life expectancy is 64. Afghanistan's life expectancy is 60.
But those people have war.
Yes.
There is war in those countries. Oh.
Yes. Right.
Can you imagine that?
So ours is an...
Then we're calling ourselves giants. Giants call Anthony.
Wait, let's hear the expert. Go ahead, please.
So ours is an invisible battle.
Right.
You know, right now.
Who is doing us?
Spiritual.
Who is doing us?
I don't know whether it's the snakes or the monkeys, but something is definitely happening. And when you look at it, you have to ask yourself, so what is government's priority? In all of this, are you looking at the figures? Are you looking at the mortality rates? Okay, so what does our health system, you know, look like? You know, there's no argument that we've got the best hands in Nigeria.
Very true.
There's no argument. It's clear. Right. However, what are we doing with the best hands?
They're not paying them well.
But is that a fair question to ask?
Because
is that a fair question? Because if you say, what's our priority? Electricity is key. Infrastructure is there. Education is there. So the government is thinking, okay, I don't have minimal funds. Where do I put this money? So maybe this is where we need the NGOs or international communities to even assist us in this area. What are your views on that?
You see, that's when you see it's always the case. You know, when you look at the government's budget, it's so important because that's where you know where government's priorities lie.
Yes.
So, you know, you look at it on the face of it. So in 2018, what does government want to do? And how does it compare, you know, internationally?
Yes.
And that's how you know whether they are serious or not.
Yes.
So in Nigeria,
yes,
the 2018 budget, you know, is 3.9% of the total budget.
Can you imagine? For healthcare.
For
health, too.
Now, the international standard is 13.
Can we compare ourselves to international standards?
We have to start.
Look,
now? Let us start from some.
Let's be realistic. Let's not be realistic.
No, we are being realistic. Let me explain. Any government that is serious about progressively realizing development will continue to increase the budgets.
For health.
For health. For health, for education. Those things that you need for development and to establish your future. So we cannot always say it's international standard. What is our vision?
You just did 10 and you are talking about vision. This you just do 10 and you are talking about vision. What is the government's vision?
What is our vision? Where do we want to? Do we keep saying it is okay? It is not okay. Especially when you know that Nigeria has serious corruption challenges. So you need to have your priorities right.
Maybe it's because we have a survivor.
Sorry, can you comment on the Minister of Health? going to meet the president's son.
That's a different issue.
Can you comment on it?
She's a researcher.
Going to I am asking her.
I can give my opinion.
Yes, please.
Ethically, it is wrong.
So that's all.
We've all said that here. They said we agree. Go ahead, please, Nima.
Ethically, it is wrong.
When people are dying in hospitals.
Maybe because Nigerians
What if it's his uncle? Just go and receive him in the airport.
We have survival instincts, or what would I call it? There's this thing about Nigerians that you throw anything at them, they survive it. You throw lemons, they make lemonade, they survive it. Nigerians have every ways of... We fought Ebola.
Yes.
We survived it. Maybe that's why our government are laxing on these issues of growth, because we know our population is growing part-time. In Lagos State, for instance, they have the statistics that over 3,000 people come into Lagos on a daily. It's because other states are failing to build their city centers and improve living standards in their cities, in their capitals.
So Lagos State can cope.
This seems to be the only urban whatever that people know. Urban, I want to progress, go to Lagos. That's how you make it.
It's like going to
London. So
London,
it's overwhelmed. And the state seems to be planning, but it seems to be something just is gulping it.
Right.
Why are other government not foresighted? Is it because we can survive it and Nigerians are just strong people? Are they abusing this? What is happening exactly?
Good question, Nima.
It's a question of revenue.
Yes.
You see, in other states, they don't generate revenue
Like Lagos does. Very
For
true.
example, Lagos is quite progressive, you see. They have the current budget that's just been passed.
Over 1 trillion.
Well, over 1 trillion.
Yes.
And what is health share in it?
Well, the
8.8.
capital is almost 60%. Capital expenditure.
Yes. And out of that, 8.8% goes to health alone.
Oh, really?
Yes.
Okay.
So,
And then federal government is 3.
3 of the total, but in the sum it will be small. It will be more.
Yeah, of course.
So you see, the thing is that for Lagos State, there is an opportunity. I'm not always about what is wrong, what's wrong.
Yes.
There's the opportunity.
Yes.
Now, you see, do you know that Nigeria spent about $1 billion on medical tourism alone?
Can you imagine?
So we have
Times how much is dollar now? About 3
something.
350.
Let's even say 350.
Okay,
Let's
good.
dash them 350.
So let's just
probably 400.
do this math with me.
Yes.
So that's 1 billion times 350. That's 350 billion naira.
On medical tourism.
On medical. So we are
And my health
spending
was
the
not there.
money. We are spending the money. How much is our national health budget?
50 billion.
340 billion. So the people are matching the government. And it also shows you that there's a potential.
Yes.
That if you provide the right infrastructure,
Nigerians will stay here.
Nigerians will stay here. If Lagos State, people, this is free advice.
Yes.
So it's an opportunity. Right. If people keep coming to Lagos State, if you have medical tourism in Lagos State, you will make a lot of money.
One of our colleagues in TVC was soliciting for funds for his son's surgery, and he had 2 options: stay in Nigeria. We have the resources, we have the doctors, we have the expertise, but it's going to cost him 10 million naira.
In Nigeria.
To go abroad
is
cheaper. 2 million naira cheaper. So that goes back to the infrastructure. Electricity, why is it more expensive? We're going to pay doctors, we're going to use generator, we're going to do, there's so many other additional things. So whether you like it or not, yes, our budget for health is not buoyant. But at the same time, there are other factors like electricity that is key. That once power is stable, all those other things would work easily and it would be seamless, and hopefully that would even bring up the cost of people like this instead of going to India for medical tourism. So that's the kind of challenge the government is having to face. Which one do I prioritize? Do I prioritize NEPA, education, or health? And, been in this X amount of years of rot. So as much as we want to lament, we must also put ourselves in the shoes of leadership. If you are there, how would you fix it?
No.
Let me tell you how I will fix
it. Wait. Morel, I just need to answer you there. Yes. If I put myself in the place of leaders, in the shoes of leaders, no problem. It's difficult to fix. Right. Why are they going abroad?
Okay. They don't want to die.
So they should go and we should be here. Very good. So that's my answer to that one.
Okay, fantastic.
So please.
May I say how I would...
Good response, yes.
May I say how I would fix it? We know that we have a problem in our expenditure, capital and recurrent. As far as we're spending most of our budgets on paying salaries and allowances.
I need your salary matter.
It's true.
I need your salary matter.
Wait, now, Morayo. So in TVC, we want to do 100 naira work. And we are paying this staff 70 naira.
Somebody has told us about this assumption that they earn 30 million something. Somebody has come here on the couch and told us they don't earn that amount of money.
It's not just earning. It's how much that they spend for governance.
Frivolous things.
They
Frivolous spending. Trainings and all that.
Right. And all those
computer.
Okay, let's go on quick. When we come back, we'll take calls. Stay with us. We'll be right back.
Stay tuned. Your View will be right back. Welcome back to Your View.
Thanks for staying with us. People have put us in trouble. They're calling us from Alausa now. So we have Chairman, House Committee on Health, Honorable Segun Olunade on the phone. Thanks for calling in, sir.
I heard Jumoke laying an allegation concerning one of our hospitals. I think when we have issues like this, we should please communicate same to the appropriate quarters.
Okay.
Because we are here representing the people of Lagos, and we would continue to serve them better. Okay. Our efficiency level must continue to increase on a daily basis.
Okay.
So we cannot say that we are perfect, but we are trying to improve on our efficiency level. Okay. So if we are not doing it collectively, it becomes an issue.
Yes.
That's number one. Number two, we talk about the issue of having our $1 billion
medical tourism.
Medical tourism.
Tourism, yeah. I want to say this. People pick the money to go to Germany, to go to India for several health issues. But can they pay the same amount even in Nigeria? That is the issue. We are not ready to pay.
Confidence in the system.
Yes, we do not have confidence in the system to pay. And it's not that
my own family does.
We have the personnel and we have the facilities even in Nigeria. It's just because we don't have confidence in the system. And we must continue to promote that within our system so that people can know that we can do these things in Nigeria.
Fantastic.
Honorable sir,
thank you very much, sir. Yes.
Since we've brought it home that people do not have confidence in our health system, what can we as a people do to make sure that our people now, we get this confidence back? Because whether you like it or not, if you compare what you get outside, you would not have confidence in the health system in Nigeria.
Very true, sir.
Well, my brother just had the operation with his daughter, and he had it here.
Yeah, go ahead, sir.
Yeah. The issue is that, like somebody has highlighted earlier on your program, concerning the fact that if Lagos is doing what Lagos State is doing today, let other states continue to build on that. Because when you go to our facilities, you see people coming from Benin Republic, from Ogun State, from Anambra. People travel as far from Bauchi, Maiduguri to come to Lagos to access healthcare. And I think the more we do this, federal government need to do more in that aspect.
All right, thank you very much.
I agree with you totally on that.
Thank you very much, Honorable. Yes, I can talk about the surgery that your brother...
Yeah, my brother just, he definitely cannot afford to send his daughter abroad. So he had it done here, and
it was successful.
It looks successful.
Let's see some tweets.
Honestly,
if you have blunt disease.
If you have the money, there's some private hospitals, but you may not take your child to a public hospital if you have the money.
Bisola says, they say health is wealth, but our government don't seem to understand that word. That is why they take it with levity when it comes to contributing to health sector in Nigeria. Amagbola says, do you know there's a cancer center in Ghana where Nigerians travel to for cancer treatment? That particular cancer center was to be built in Nigeria, but the investors were frustrated with the many demands in the form of bribery by Nigerians. Now, government caused that.
Can I take one?
Dan, Chris ABS says, please, Sister Yeni, tell TVC that the station's adverts are too much. They're giving us less time to talk.
Okay, Salem Secret says, our leaders need rehab. That's the one I really wanted to take.
Our
leaders need rehab.
Bashir Arre says, I am sure Morayo prefers international standard for the aviation sector due to safety purposes. Why not for education and healthcare? Big Bill says, Morning, beautiful ladies. This government failed us in totality. In aspects of human endeavor, it's painful. Nigeria is like this. Fowles says, if only TVC can play back the campaign videos where APC was cleaning generators with erasers and promised to feed students. If you promise 5 things, at least do 2. That you met on ground. Adekunle says, we talk too much in this country without headway. Guarantee you will soon come back from same topic. Yeah, leaders leading Mumu Naija.
Hey, all right. Let me let our guests have the last comment.
These things, they were promised. That is what is even paining me. This, you promised, you said, and then you now, on that promise, first of all, you went for 3 months for your own...
105 days.
Imagine. And you packed a plane there for 360 pounds,
right.
1,000 pounds. That's 0.33% of
I don't even
our
understand
healthcare.
you people anymore.
All right. Unfortunately, we have to round up.
Talk.
We have to round up. Thank you. Let me let you have
insane.
the last words. Yes, we've all lamented. Honorable has called in to try to alleviate
our fears
and all that. But in your own view, any solution inside, especially in the issue of building confidence in the health sector, because some of us, is it you that want to die? That you put yourself as an experiment. Let me go and see if I can do my surgery. So how do we change? How do we change that perception?
I think one thing that we are not really good at in Nigeria is communication, especially between government and people. So, you know, if government were to listen, then they will be able to say, look, this is what we are going to do, and you do it. It's as simple as that.
Yes.
So you want to build confidence, let people see what you have done.
Fantastic.
So we are talking about infrastructure, we are talking about, you know, health workers' salaries, we are talking about a different culture about the way we do things.
Because
that's it.
Nigerians are leading the medical world abroad. Many of them. I know my friend, he's the head of the NHS in London, in England.
Imagine that.
His wife, him and his wife. Imagine.
And what I take out from this is how we celebrated at that level.
Doctors.
We need to celebrate more Nigerian doctors who are doing amazing jobs. Put them out there, project it, let people know that we have experts who are doing things. Once we do that, hopefully people now start restoring confidence.
My miracle consultant.
Yes. Hey. So there are some amazing doctors we must celebrate. So I think that's our next show.
Amazing.
Let's get those doctors, bring them in the studio and celebrate them.
Yes. I agree.
That's all we can take on this show.
Thank you for the wonderful doctor.
That's all we can take, but to you by Hypo. Thank you very much for Hypo for sponsoring our show today. Don't forget, our live audience is on Wednesday. We have a gift for you. Tomorrow, if you come very early, for the 30 on set, we have one of our sponsors giving away free gifts. So please come early. Have a fabulous day. We'll see you tomorrow.
Hypo to the hospitals.
Bye-bye.